Hi, my name is Kelly Mayer, and I would like to introduce myself and explain some areas where I think quality and safety has really improved in healthcare. I've been a nurse for over 30 years, and so as you can imagine, I've seen leaps and bounds of improvement for the care of our patients and both safety and the quality of care that we're giving. One of the major priorities or changes that I've seen is, of course, with electronic medical records. To be able to have a patient show up in your emergency department, urgent care, doctor's office where they've been seen before and be able to just pull up medication lists, previous surgeries, uh, previous comorbidities, and know immediately kind of what's going on, what's been going on with this patient is really incredible. And it just takes a couple clicks on the computer to get to that area. So that first and foremost is huge. Also looking at barcode scanning with the patient's ID, their wristband to confirm correct medications that they're receiving, dosages and times. Just another quality improvement for the safety of our patients. That is another big game changer. Not to mention all of the technology surgeries that we can now perform that even 10 years ago weren't possible. So um, we've all seen healthcare continue to grow and improve, which is as needed. So looking into an area of where I feel like I've witnessed somebody that has really not had quality care, I would revert to the STEEP model. Would it be a family member that had gone into the hospital having some issues and was deemed to needed to have a colonoscopy for possible polyp that might be causing some problems? What I saw was that person's regular GI doctor was out of town, somebody who was an incredible physician and would have waited to have done something just as simple as a colonoscopy until the patient was feeling better. Instead, that while the patient was in the hospital, time wise, I feel like the timeliness was that this could have waited. This person had had a low sodium and potassium and had been previously canceled by the anesthesia team, stating that it wasn't relevant to do it at this time and to wait. So another day had gone by, and once again, anesthesia had deemed the patient was still not appropriate safety wise to go back to have the procedure because of again, low sodium and potassium. So on the third day, the same GI doctor who had just really been waiting to do this procedure, it was a weekend, and he had the nurses on call for the GI clinic come in and do sedation per the nurses. So effectiveness was, it could have waited, definitely. Efficiency, there was no efficiency in this. I feel like it was all just the doctor wanting to get paid for doing the procedure he'd been waiting to do for several days. Equity, equality, I just feel because this person was elderly, I feel like he was taken advantage of because he didn't know any better than to say no. And so what this ended up doing was, after this person had anesthesia, he was in the hospital for over a month recovering from too much sedation, not being able to cough deep enough, going into a pneumonia. And it actually led within a couple of months to his demise. So you can just see how one little aspect of something so simple as a colonoscopy to get to the bottom of something, which the colonoscopy showed a tiny polyp, which was not even an issue. And this person was no longer having any issues regarding this. So you think something that is simple, but not everything is for everybody. So if there had been a time to be taken back, stepped back, and waited, I think things would have been a much different scenario for this person. And then just sharing some personal things about myself. My husband and I, we have 4 children, and our 2 daughters are both nurses and work in the Kansas City area. And our 2 sons also work in the Kansas City area. I have got one more class after this, and then finishing up for this master's in quality management. So that's pretty exciting. And what else? I've run 1 marathon a number of years ago, so 1 and done on that. And really, that's about it. So I'm looking forward to meeting you all on webcams and reading about your thoughts throughout this course. And I hope everybody has a great weekend. Thank you.